Well, thank you. Welcome, everyone. We have succeeded at successfully getting ourselves linked in live, and we've got a really awesome program for you today. First of all, I'm Dan Seawald, and I'm joined here by two of my great friends and experts, Xuan Gui and Greg Lewis. And we're going to be this afternoon, this Friday, really digging in and talking about the deliberate way that companies and people take a really innovative approach to different things. And our first topic, I think you're going to be really excited about. We're going to explore how Amazon is going to go full on into healthcare. Maybe they already have, but we're going to look deeper and try to understand exactly what they're doing, the deliberate approach that they're taking, and what you might be able to learn or take away from it. But before we talk about any of that, just a couple words about the deliberate way. This is our first foray into the deliberate way. What's the deliberate way all about? Well, a number of years ago, one of the things that kept coming up in conversation is there something that's sort of genetic or hereditary about the great innovators, Ben Franklin, Thomas Edison, Steve Jobs? And is there something specific about them and the organizations that are always breaking the rules and changing the game? Now, there's no doubt that there is a piece, a component, which is part of one's DNA. But there's also a process or a way, if you will, an approach that others can take, they can replicate, and they can apply. And one of those organizations, one of those people who lives inside of Amazon has created a vision that we think is really interesting to explore here today. So we're going to dig deep and talk about Amazon and what they've been doing. Now, for those who have not been living in the 21st century and know very little about Amazon, they're the size of the company, over 1 million people working there, $1.2 trillion in market capitalization, makes them one of the biggest companies in the entire world. And what's interesting is if you combine Holland and Belgium together, they're about the same size in terms of value. It's unbelievable. And what really stands out, though, is you really can't go anywhere or buy anything without really hearing about Amazon. Whether you're buying underwear or Halloween decorations, it's kind of the first stop for everything. And the question is, are they taking over? Is healthcare the next stop for their forays into this space? So we're going to dig more into that. And I first want to welcome two of my friends here. First off, I want to welcome Greg Lewis. Greg Lewis is the president of the highly acclaimed digital agency Calcium. You may know him as a longtime healthcare insider, a managing partner at Gray Health, president of Havas Health and You. And he was actually one of the top 100 leaders according to Pharma Voice not that long ago. Greg, it's great to have you here. And by the way, if we're looking for you during the day, we could find you in Mountain Lakes, maybe chasing around 5 of your kids along with your wife. Greg, great to have you here.
Thank you, Dan. Happy to be here. I just want to put it out there. I do not buy my underwear on Amazon, so we'll start there. But yeah, thanks for having me. I am lucky enough to lead Calcium. We do medical education, advertising, public relations. So that's kind of my day job. And as Dan said, my night job is chasing around 5 kids that trying to set them right on a good trajectory for their life. On the weekends, I'm part of 2 nonprofit boards. I believe in giving back and really making sure that our communities are ready to thrive. So thanks for having me.
Awesome. Great to have you, Greg. And our other partner in crime here, Xuan Gui. Xuan is one of the OG digital thought leaders. He is an original, a trendsetter in digital health and innovation. And aside from having spent time leading digital teams inside of many large pharmaceutical companies, Novartis, BMS, to name just a couple, he's also involved in multiple advisory boards, from Google's healthcare advisory board, South by Southwest, the Digital Health Coalition, and a bunch of others. And actually, I think, if I'm not mistaken, Gwen, just recently, was it Medica had said you're one of the 50 most influential voices in healthcare. So awesome to have you. And, I know that you are normally, we could find you in the Boston area, but you're abroad today in the UK, if I'm not mistaken.
That's right. I'm calling in from London today. And thank you, Dan, for inviting me. This is a real pleasure to be here with you. Again, I've been a long time admirer of the stuff you've done in big pharma companies as well. So it's great to be here to share the stage with Greg and yourself.
All right, well, let's cut past the preliminaries. Thanks, guys. And I want to just go beyond the biography. Tell me a little bit about your general thoughts. Digital innovation. Before we talk Amazon, what's the state of digital innovation? What's happening? It seems like things have been taking off in healthcare. Maybe it's made it rife for Amazon to look at opportunities and say, hey, we too can play in this space. So I'll put that up as a toss-up for either of you guys to jump in. What's happening in this space, broadly speaking?
Yeah, first of all, digital innovation are two very broad terms that when you put them together become even broader. And especially confusing is the terms we use in healthcare, like digital health or health tech and so on and so forth. And so lately, if you try to constrain what actually defines digital health, for example, there's been a lot of discussion. Where does it stop and start? Is it include all the stuff that we do in IT? How about decentralized trials? How about real world data? How about digital marketing? Is that all digital health? And so I think there's a lot of confusion around what is digital health. And then beyond that, what is really considered digital innovation? Because you could also have incremental innovation, disruptive innovation, and so on and so forth. So that's why it becomes very confusing. But if we want to talk about what's happening in the market, I think the biggest thing to happen in the healthcare industry that really has driven innovation to a whole new level is the pandemic. And we're all coming out of it. But what it did was it forced us into a world where we were made to start using the tools that were all digital because there was no other way to connect face to face. And so things that have been around for a while had suddenly gone from, low single digit adoption to 80-90% adoption, things like telehealth, for example, right?
Right.
It's been around a while and suddenly that has taken off. And so all these digital and virtual tools that have been around, that have been adopted and maybe flattened in terms of the adoption curve, suddenly took off. And I think that's really the biggest change that's happened that's really driven innovation to a new level, both in terms of things that people are starting to come up with, as well as the investments into them. And that's a whole revolving cycle in itself.
I can't help but say that, during COVID, because we were here doing this all the time, we had to get very scrappy and improvisational. People are forced to have to do things a bit differently. And whether it was, how you could kind of program your Alexa to wake you up or tell you to do things, or using your smartwatch to kind of keep you moving, even though you're housebound for periods of time, it almost has ushered in a new era of digital health, or opened the door for it. So you're right, definitely very nuanced. But Greg, you are frontline working with clients day in and day out, and they're probably trying to figure out, how do we stay on the vanguard of this sort of amorphous thing of digital innovation? What are you seeing? What's your take?
Yeah, I mean, I would agree with Xuan. Those two words, digital, lots of definitions behind that, and innovation, lots of definitions behind that. In the world that we live in, everything's digital, right? So as with the pandemic, we now have to plan for hybrid meetings. Some people are going to be in person, some people are going to be remote. I think from most of my clients' marketing plans, the majority of their spend is trending in the digital space. And the important part of that, and I think where true innovation is found, is really on ROI. How many patients are we impacting? What is the level of education that we're driving for physicians? And are the activations that we're putting out in market having that impact?
Yeah.
And innovation could be small. It could be a tweak. It doesn't have to be this master, replanning of a client's marketing spend or trajectory.
Well, coming back to the idea that it could be small, some things are big. I'm going to come back to the topic, which, as advertised, about Amazon and how they've kind of made some simultaneous big moves and incremental. It seems perhaps that it's, part of a grander strategy, or maybe it's not. That's a kind of a toss-up question. They just acquired One Medical. And for those who aren't familiar with One Medical, and One Medical has kind of got this kind of primary care business. They're almost have a concierge-like offering. You pay an annual fee, and you're able to use their offerings, their service. And this is a big move, seemingly. A lot of people in the market thought it was a big move. What's going on there? What's your initial take? Is Amazon kind of going kind of full in on healthcare? Are they still dipping their toe in and trying to kind of create waves of innovation in other ways? What do you guys think? And I'll turn that over maybe first to Shwen. Shwen, what's your initial reaction? Because still there's a lot in the news cycle about it, but it's kind of gone quiet of recent.
Yeah, I think the first thing that you should ask yourself is, is it really true that we're saying Amazon is only now coming into healthcare? Because I think we're looking at the recent acquisitions and deals they've made over the last few years and going, wow, they're starting to dip their toe in. But if you look at the history of where Amazon has really built their business, and you think about Amazon Web Services and the cloud infrastructure they've built up, almost every major healthcare organization, pharma, payers, and so on, have built it on Amazon Web Services, right, on their cloud. Mm-hmm. And on top of that, all the startups are also leveraging them. So they actually have been in this space for a while in a very different sense, right? It's that technology sense. Now, what's happening over time, though, is that they're starting to make these acquisitions, which are starting to integrate with their main consumer-facing business, which is that big, giant warehouse full of anything you want to buy online, like you said, from underwear to Halloween goods, right? And they're starting to integrate that in. And so, the acquisition of PillPack was for a pharmacy that they now have, and One Medical. And the reason One Medical is interesting and why it's made a lot of noise, I think, is twofold. One, they had dipped their toe and, had a foray into telehealth through Amazon Care, their service that they provided first to their own employees. And then the second reason is because while you think Amazon is all things digital and virtual, this is a brick and mortar play. So where is that? How does that fit into this giant online service that usually is that interaction that they have? It's all virtual. So the question becomes like, where does brick and mortar play in this virtual giant?
Mm-hmm. And I just a quick follow on is when you look at what they've done with Whole Foods, when they made that move, when I saw that, I thought, what in God's name are they doing? Are they in the organic foods business now? But as time has been going by, it's starting to look like a more savvy acquisition. They're using it as distribution depots. You can drop off, return stuff. They're now even potentially, there's rumors of how they're in Italian nutrition in healthcare. A very unexpected, that was not an area I would have thought they would have tied in. But, Greg, your thoughts, is this just putting the toe in the water, or is this part of a grander scheme to be able to dominate healthcare? Your thoughts about that?
Yeah, I always like context on things. So when I read the press and Amazon's $3.9 billion investment in One Medical, I couldn't get my head around it. So the other day I asked my Alexa, I said, Alexa, what were the revenue sales of Amazon in 2021? And not to put you guys on the spot, you don't need to answer live, but it ended up being over $400 billion.
Yeah.
And then my wife, who's smarter than I am, said, okay, well, ask what their profit was on that. And their profit was 18 billion. So I think they're trying to figure out, they've mastered understanding user behaviors. And now they're trying to figure out, how can I come to, in this case, the patient in a stronger way? So to me, it's a bit of a pilot and expensive, but it'll be interesting to see where it pans out. I have lots of thoughts around just the shifting of the healthcare system and can Amazon, the halo of Amazon, really play in such a care-centric place? But we could get to that later. Yeah,
I'd love to talk about devices. That's an interesting one. Just to come back for a moment, though, as your point, $4 billion sounds like, wow, that's a massive acquisition. But in the scheme of things, when you have 1.2 trillion in market cap, it's a rounding error. It's a small little experiment. And I think you bring up a really good point. This may be not just dipping a toe in the water. It may be a thoughtful experiment, much like Haven. And Haven was the combination of Amazon, JP Morgan, Berkshire Hathaway. That got shuttered. It was seemingly a great idea. They were going to change the way healthcare worked. Didn't work. But it was an experiment. So perhaps this is part of a broader experimental strategy. But let me take a step back for a moment. When you think about Amazon,
I was going to say, could we talk about the experimental piece? Because I think what's interesting about that, and I'm sorry to cut you off there, but it's important to think about, with what you guys both just said about the financial stability of this company. These experiments are important. We always talk about that in innovation, which is to be able to test and learn, to be able to create these experiments, test hypotheses. They're just doing it at a completely different scale than all of us think of as experiments. And they are willing to take the risks to learn, and they're doing it in a very visible way. And so I think they've learned a lot over time. And so their investments, like you said, might be rounding errors, but they're learning a lot, and they're trying to do things to get to the right place. And therefore, I think, this experimentation is actually really important for them. We may see it as failures sometimes, like Haven, but actually they learned a lot from that. They realized how difficult it was, and they realized it's easier to actually maybe acquire something than to build it from scratch.
So that begs a really important question. I started off saying this is the deliberate way, and we're talking about Amazon. What does one have to do with the other? And I'm glad you bring that up. Do you feel, both of you, is this a deliberate approach? Is this a deliberate strategic approach towards experimenting? Is this something that you think is a more emblematic of what great innovative companies do? Or is this kind of an anomaly, something that really is more Amazon specific? What do you think? What would you take away from that? If you're another company, you're like, what can I learn? Is this a deliberate approach? Is it something we should replicate? What do you think?
I mean, my take is they're trying to get into all facets of life, right? When you just said before, Halloween and underwear, they have it covered. Alexa wakes me up in the morning. My $35 device versus my $600 Bose Wave radio that I always use. Like, they're evolving and simplifying life. The question is, do my personal healthcare decisions, is there going to be a bedside manner that's being presented from Amazon in a way that I expect it to be? And how will physicians be judged, ranked, starred in their interactions with patients?
Yeah, well, let me come back. Let me come back to that for a second for you, Greg. So when you think about what they do really well, why do we go to Amazon? Why do I go to Amazon first? I mean, it's almost reflexive now and I don't buy my underwear from there either. My wife does, but for me, not for herself. But when you think about Amazon, I go there right away. Before I even go to Home Depot or to Rite Aid, I'm going there first. And there's something that's inveigling or drawing us in. When you think about them as an organization, why they may be uniquely suited to do healthcare really well, what is it they're doing well now that makes them well positioned for healthcare? Well, I'll start with you on that, Greg. What do you think?
I mean, I think just for context, or I would call it fair balance, like I go there a lot too, but I don't go there
just not for underwear.
I don't go there for important decisions. If we're buying a great light fixture in my house, probably not going to go to Amazon. If I'm looking for, other maybe higher end value things. And I think most people look at their personal health as higher end value, right? So I think that there's going to be a trade-off there. Like, will Amazon play in the generic space? Of course, and they should. But for those more serious conditions or communities, I mean, the drivers in the healthcare segment right now, oncology and rare disease. And oncology and rare disease patients need a community around them, and they're very much participating in every step of their healthcare choice. Mm-hmm. So I don't see Amazon stepping in as strongly as other centers of excellence or areas of expertise for that patient target. And knowing that's the largest growth target within our industry, how will Amazon navigate that space? The one size fits all, although they have a customized experience, there's still a one size fits all mentality from the Amazon experience that I'm going to be served up the same Halloween costume as you might be.
Well, let me ask you, I'm going to see if you agree with that. Amazon's become well known, as Greg's right, of having this monopolistic point of view. Like, we are going to get massive scale. We're going to have very good consistency. And then we're going to kick the crap out of our competitors and kind of run you out of business for the most part. But community building, that's not really been their thing. Your thoughts, are they well suited for things like oncology patients, rare diseases, where you've got expensive prescription pharmaceuticals and relationships, understanding the customer matters? Can Amazon do that? Or is that just not going to be their bailiwick?
It's a great question. And I was actually going to answer some of the previous two questions and follow up on that. But I think to answer this specific question, I think the thing is, we've seen the power that they have to, try new things, experiment with things, acquire things, and they don't have to be good at something. They just have to be able to acquire it. And that's all that's needed, really. So don't look at what they're good at now. Look at what they need to add on to become good at it. And that's probably how they're thinking. And that links back to the first thought, which I was going to answer was it deliberate, right? If you look at their acquisitions, if you look at what they've been trying to do, they haven't all bought or tried to do the same thing in the same space. They've actually started to work across the entire industry at different parts of the system, right? A pharmacy, a primary care, system, and so on and so forth, a wearable device. And if you start thinking about what that means is these interconnected pieces of data that actually can be very powerful for any person and their health and well-being, which is the hardest thing for us to achieve in the current health system that we have, because all our data is disparate. It's held by different people. You go to a different doctor in a different hospital for a different disease, and then you go to a different pharmacy to get, your medicine. Like everything is separate, and all those data stores are separate as well. And to get connected is almost impossible. But if there was a closed system where it was all connected, and I go to the doctor, get my medicines from the same source, and so on and so forth, right? And you can see all those connections. It becomes much more compelling and much more ease. And what do we come to Amazon for? Convenience and the user experience. I mean, they're customer obsessed. Their user experience is what they're trying to drive, make it easy for you to one click and it's there. In fact, you don't even have to one click these days. You have to just remind yourself every 30 days and it's going to come to you. It's going to arrive. And so I think, what they're trying to do is a bit like a Kaiser Permanente, is build that close integrated unit for all parts of the system.
Very, very good points. You're right. The convenience sells. Greg, you had something on your mind.
I was just going to say, and I don't want to sound like negative against Amazon taking over the healthcare world, but to Xuan's point, I mean, he makes a really good point that they understand your user behavior. They're beginning to understand my supermarket shopping at Whole Foods. Now, if I'm getting generics, it'll be a much more regimented auto refill system. Alexa can be reminding me. So it begins to paint this ecosystem that surrounds my health beyond just the pill that I'm taking, but also, things that I'm searching out on Amazon, different foods, different vitamins, different exercise equipment. It can all be aligned.
Yeah. I think you're painting a very interesting picture. I'm becoming more convinced this is a very deliberate strategy. It really starts to make sense without having the inside scoop of what they're thinking. Now, I do want to mention we're going to do a couple more things. So first off, we did poll our audience, and thanks for the folks who have logged on, and a number of people who said, I want to join. I don't know if I can join, but if I join, I have a couple of questions for Xuan and Greg. So I have a couple of questions from our audience that have come in advance. So one of the questions that somebody had sent over to me that works in a PBM, prescription benefit management company, they're worried. And they said, I just heard Mark Cuban not too long ago being interviewed. And he entered also into the prescription benefit or the non-prescription generic market. He was quoted as saying, Amazon's margin is my opportunity. So he's launched not very long ago a company called Cost Plus Drugs, I believe, the Cost Plus Drugs company. So he's entering the fray also. It's drawing a lot of people that were unusual suspects to come into the market. Are you surprised by that? Is it strange to see a Mark Cuban come in? And the guy owns the Mavericks. He's on Shark Tank. Now he's a healthcare entrepreneur. Xuan, your thoughts. You're in the startup space. Yeah. Not sure how Mark Cuban and others fit into this. A lot of competitive pressure coming from different places.
Yeah, Mark Cuban actually has been very involved in the healthcare space for a long time and has been an investor in companies in healthcare. I remember seeing him at South by Southwest many times. He was actually the host of a pitch competition for pediatric healthcare, for example. There were other health conferences and events that he's been at where he's been very involved in talking about what needs to change for healthcare to truly be much more accessible and available to everyone, right? And I think that's the play he's making now. Is I think there's so many challenges that we have in our healthcare system right now that he's making a play to make it much more efficient, much more available. We all talk about how access and equity is really important, but if we have this system that continues to just do what they do in the same way, nothing's going to change. So you've got to really disrupt it by doing something different. And that's what he's coming in to do, is to basically come in with cost plus drugs to cut out the PBMs and take that margin away to be able to then afford to provide the generic drugs at a much lower cost than otherwise.
Very, very interesting. Greg, I want to flip another question to you, which is, we talked about this very briefly, we just referenced this, but somebody asked the question about the failure of Haven, this combination of JP Morgan and also with Amazon and Berkshire Hathaway. I mean, you had some of the luminaries, Bezos, Warren Buffett. I mean, how could they have failed? And I mean, it was like a couple of years and it just went down the toilet, and it was so highly publicized. How did Amazon get that wrong? Or I know Shwen said it was a good learning opportunity. What didn't go right? Is there anything that we could pick from what didn't work there that might be an intuition for folks about other things?
Yeah, I mean, from my understanding of the partnership, it was business oriented, right? It was all about stringing businesses together, kind of opposed to what Mark Cuban did. Like, he's taking a much more empathetic approach, and he's actually kind of calling his group a public benefit corporation. So, Mark is taking a more empathetic, sympathetic drive to build this need, to serve this unmet need for these patients and other healthcare providers. Whereas I think that the prior experiment was more about Warren Buffett just trying to figure out a business model, but it didn't have the empathy. And maybe it didn't have the insight as to who was the right patient or what was the right target for them to start.
Building on that, there was another question that actually came in through the live LinkedIn from Joanne. And Joanne asked about Amazon. How are they making the connection with the patient, making it more personalized with healthcare now? Like, what can they uniquely bring to bear? And we, again, have kind of alluded to this already. Like, you have reams of data. You have stuff coming in from Whole Foods and from other devices and AWS. How are they going to take advantage of that? And does that potentially put them in a really unique competitive place versus everybody else? I'll flip that to you, Shwen, but Greg, do weigh in as well.
Yeah, I think, Greg was alluding to this earlier when he was talking about how Amazon already knows about his buying behavior, both online and at grocery stores like Whole Foods, because they're collecting that data and they're starting to sync that together as the same guy that's doing this and this. Now, imagine we get to a world, they also have a wearable called the Halo. They also have now brick and mortar store, as well as telemedicine. It's kind of a virtual hybrid approach to primary care. And they got a pharmacy. You link all that data together about the same person, and you start to see the ability for them to start to know much more about the user behavior and to be able to send you reminders or target you for certain things at certain points in time when you need it. So I think the easiest way to think about this is, instead of only slices of your entire journey as a patient, they're starting to be able to piece those pieces together and see the entire journey. And they're starting to know when they need to connect with you at certain points. So it's much more personalized, and they have all the different outlets to distribute what you need. Hey, the primary care here, call either through telemedicine or go visit a store. By the way, once you want to get your drugs prescribed, we have a pharmacy here that you can go to. And then as you start to take these drugs, if you want to keep monitoring yourself, by the way, we got this Halo. That's how it starts to become this closed loop of data that starts to really inform the human behavior.
Greg?
Yeah, and a closed loop that might transcend generations, right? Like, if I'm a father with type 2 diabetes, luckily I'm not, but if I am, Amazon has that data. They might profile my children in a different way and make stronger recommendations to them to maybe avoid the trap of type 2 diabetes.
I can see it. I can see how this could change. You're on Amazon and you're buying Malamars, and you may want to think twice about the Malamars. I'm not saying we're going to get into medical advice, but nutritional advice, maybe fitness. Dan, you've been a little sedentary today, And that type 2 diabetes, that's something you got to watch out for. That may sound big brotherish. I don't think it is necessarily. All right. We have just a handful of minutes remaining. This is a pretty tight agenda, guys. But my favorite part, something we love doing, is around speed rounds. So I have a handful of questions that you don't know what they are yet. So I'm going to ask you the question. What I'm going to ask you to do, though, is to give me just sort of a dichotomous answer, a yes, no, maybe, maybe not. It'll be kind of straightforward. Then I'll ask you to elaborate. So I'm going to ask you both to give me your quick answer. Then I'm going to ask you just a 30-second elaboration on it. Everybody good? All right.
Good.
Ready for the first one? All right. Let's consider this a warm-up. Your favorite healthcare app, Greg?
Coming out of a meeting 3 years ago with you, Dan, it's my Oura Ring that I finally got for Father's Day this year. Tracks sleep, tracks movement, tracks my heartbeat, everything.
All right. That's a big cult around Oura. It's a big cult. If you guys don't know Oura, you got to check it out. Schwen?
I won't say it's an app as much as a device. It's my Apple Watch. It does everything I need, from Apple Fitness to tracking my runs to my heart rate and so on. So love my Apple Watch.
All right. Who dominates healthcare first? Who dominates it first? Is it Google? Is it Apple? Is it Amazon? Greg?
I think Dr. Google already dominates it. The number one search at 3 a.m. in the morning is ear infection. I think everyone goes to Dr. Google and then YouTube, but TikTok's on the rise.
Interesting. All right, that wasn't on the list, but that should have been. You're right. Schwen?
I think each of them dominate in different spaces. That's what I think. So Google, like you said, has search and all that, but don't forget, they have two life science companies. They have Verily and they have Calico, right? So they already have life science companies that are doing things in life science sort of R&D. Apple has the market domination for devices, right? And sensors on your wrist, in your pocket. You can't go anywhere without carrying one of those two. And then the last one, Amazon, we just talked about them. I don't need to say anything else about them. They're dominating in a very different way.
All right, well, that's a good segue because we've talked about your favorite app. We talked about who's going to dominate. We've already sort of alluded to this, but I'm going to put this out again. The most popular device 3 years from now in healthcare delivery, the Echo, the Halo, the Nest, the iWatch, or something else. What's going to be the most dominant piece of apparatus in 3 years' time? Schwen?
I still think it's going to be either your watch or your phone. To me, those are devices we're never going to part with. It's always going to be on us. And I think watch or watch-like devices, wearables, are going to be the main dominant device, whether it's an Oura Ring or my Apple Watch.
Greg?
I think it's going to go one step further. I think it's going to be a little implantable chip that's measuring my blood levels, measuring really everything that I need to know about.
Does that exist today? I'll ask you guys, have you seen it besides sci-fi movies?
Location monitoring for dogs. I think there's going to be an iteration of that for people.
That's a great point.
Yeah, I think I'm not sure about implantables in 3 years, but I like where you're going with that, Greg. But I do think getting to like patches, which are sensors, so it's much less invasive and it's much more like you don't even realize it's there. That's probably definitely, I think, 3 year horizon.
All right. Well, this is a good segue to the next question. Scared or not scared? And I'm not talking about buying underwear on Amazon. Scared or not scared? Privacy advocates are raising a lot of concerns about companies like Amazon, Google having too much information about us. Are you scared or not scared about the reams of data that Amazon just might have in a few years' time? Greg?
I'm scared.
Schwein, you're scared, Greg?
I'm not scared.
You're not scared. All right, do tell.
Yeah. Because I think it makes me smarter. I have the choice to opt in or opt out. I'm opted in on virtually any interaction that I have with consumer goods that I use. And I think their recommendations makes me smarter. And I think Amazon quite often points me to better products than I would originally find myself.
Schwein, you're scared. Tell me.
I think I'm scared not because it's Amazon. I'm scared when any one dominant player has so much of my data. All right. And it feeds into a lot of different areas, not just healthcare, but also the consumer behavior and all the other things that they're doing in this space. So it's a monopoly of data that they have proprietary rights to. And there's a lot that could go wrong when one behemoth has all of your data.
Who's got the most to lose with Amazon entering the kind of prescription benefits space? Is it places like Express Scripts, the PBMs? Is it managed care companies like Aetna? Is it physician groups or even retailers? Who's got the most to lose with them really making more active forays into this space? Xuan, you got the first bite of this.
Yeah, I think the PBMs are probably going to be the ones that are probably going to be competing with that.
Yeah. Greg?
I would agree. I think the patient audience either has the most to win or the most to lose of their healthcare.
Well said. All right. I couldn't leave this one off the table. Big Pharma. Is Amazon coming for Big Pharma prescription drugs, oncology, specialty care, rare diseases? Are they coming for them? Yes or no? Greg, first shot.
I don't think so. I think Amazon is about distribution and delivery. Big Pharma is about research and development.
Mm-hmm.
So I think they have a long game to play.
Xuan?
Yeah, I mean, don't forget, they already empower all their cloud infrastructure. So they're already in there. They don't need to acquire them in a different way. But I will say, I think, I've said this for about 5 years now, which is it's only a matter of time before one of these big tech companies acquires a life science company, an R&D company, and makes it their own, and that's their foray right in. And it could be Amazon. Who knows?
You're right. They may very well be. I think I could agree with both of you. They may not be coming, but they could be. All right. Last thing that I have to ask of both of you, just kind of reflecting on if you are a product manager, a strategist working in any healthcare related company, what do you kind of take away from Amazon's approach? If any sort of suggestion, advice that you would impart to folks who are right now looking and saying, I don't know how to plan for this. I don't know what to say or do. What would you tell them that they should be telling their CEOs and executive leaders that are asking them to keep an eye out, to build a plan, and they're not sure where to start? What would you tell them, Xuan?
Ooh, that's a tough one, man. I think it's about, first of all, let's look at how Amazon views the world, and it starts with the customer first. And I think that's a really important piece where they're customer obsessed, and they're thinking about, they're doing systems thinking, right? Which is not just the pure vertical they're in, but how it all interconnects and works together. And I think those are two things that we could learn a lot from.
Great point. Greg, you get the last word on this.
I support exactly what Xuan said. 12 years ago is about customer centricity. It should always be about customer centricity and driving a great experience, not only in the healthcare world, but also health-related world outside of healthcare. So I think you take baby steps, you do small experiments, and you see what resonates and what has impact and what drives better outcomes for patients.
I love it. It's a very deliberate approach of not going all in and seeing what works. Guys, thank you so much for taking the time today, giving a little bit of your wisdom about Amazon, about digital innovation in healthcare, and also just sort of being great, awesome, deliberate innovators. So thank you for joining. Thanks for the folks who've tuned in. Great to have you. And we look forward to coming up with some more unexpected and exotic topics related to the deliberate way. For now, thanks again for Greg and Xuan. We'll see you guys soon. Bye for now.
Thank you.